Hello everyone, today I'm going to talk about the United States Medical Licensing Examination, that is the USMLE. It's a three-step standardized exam that all medical graduates must pass to obtain a license to practice medicine in the United States. The exam assesses a physician's ability to apply knowledge, concepts and principles important for patient care. So here in this video, I'm going to go through some detailed aspects of USMLE. The purpose of USMLE is to evaluate whether a physician has the necessary medical knowledge and skills to practice medicine in the US safely and effectively or not. It is a mandatory requirement for US medical graduates, that is the USMGs, those who have completed their medical education in the US. International medical graduates, that is the IMGs, include those who have completed their medical education outside the US and wish to practice in the US. So, now, as I have already said, it's a three-step program, right? So the USMLE is divided into three steps, each testing different competencies and knowledge which is relevant to medical practice. First step, basic science knowledge. The focus over here is the step assesses the candidate's understanding of basic science principles which are essential for practicing medicine. What content is there for the basic science knowledge? You have to go through anatomy, biochemistry, microbiology, pathology, pharmacology, physiology, behavioral sciences, and there are interdisciplinary areas also like genetics, immunology, nutrition, then aging and molecular biology too. Now, the format is you have a duration of approximately 8 hours including breaks. The question format includes 280 multiple choice questions which are divided into 7 blocks of 60 minutes each. The test setting is it is administered on a computer at Prometric testing centers globally. The scores range over here from 1 to 300. As of the year 2022, step 1 is graded on a pass or a fail basis. Coming to step 2. Step 2 is based on clinical knowledge. Now the focus of step 2 is it assesses the medical knowledge and understanding of the clinical science which is necessary for patient care. It emphasizes disease prevention, diagnosis and management. Coming to the content, we have internal medicine, surgery, pediatrics, psychiatry, obstetrics and gynecology. Then we have preventive medicine also, public health also. Also separate interdisciplinary areas are there which includes nutrition, medical ethics and professionalism. The format over here is it has a duration of approximately 9 hours and the question format is it has about 318 multiple choice questions divided into 8 blocks of 60 minutes each. This part is also administered at the Prometric centers. Scoring or the scores range from 1 to 300. The minimum passing score is typically around 214 to 216, though this might vary. Next is step 3 and it includes clinical skills and patient management. Here the focus is the step tests the knowledge and the ability to apply clinical skills and manage the patients in an ambulatory setting. The content over here has patient encounters, then diagnosis and management of disease, public health, biostatistics and all. Format over here it has a day 1, that is the foundations of independent practice, that is the FIP, and 6 hours of testing is there with 232 multiple choice questions assessing the medical knowledge, diagnosis and patient care. Then you have day 2, that is the advanced clinical medicine, which is the ACM, and it has 9 hours including 180 multiple choice questions and 13 computer-based case simulations, that is the CCS. In this, candidates must make patient management decisions in real time. Scoring in this part ranges from 1 to 300 and the minimum passing score is around 198 to 200. What is the eligibility? Students have to complete step 1 and step 2 before taking step 3. That's the normal thing. This is usually taken after the first year of residency. Okay, for step 1 and step 2, US or Canadian medical students or graduates attending LCME or COCA accredited medical schools can apply to this. Or IMGs must be certified by the Educational Commission for Foreign Medical Graduates, that is the ECFMG, to be eligible for this one. For step 3 that I have said, US medical graduates must have an MD or DO degree. IMGs need to have ECFMG certification too. For the registration part and fees part, step 1 and step 2 CK registration is done through the ECFMG or the NBME, that is the National Board of Medical Examiners for US and Canadian students. For step 3, registration is done through the FSMB, that is the Federation of State Medical Boards. For step 1 and 2, approximately $975 is to be paid for the US or the Canadian students. International students may have an additional fee for sitting outside the US. Then approximately for the step 3 you have to pay $915. So if you are preparing for this examination, you can join our classes for that. All the study materials, notes and everything and live lectures and all would be provided to the enrolled candidates. And if you have any kind of queries, do comment down below. If you want to connect with us, you can check the description box below. Thank you.